What are alginates? Alginates are actually a very interesting product. They're derived from seaweed or brown kelp and are a form of algae, hence the name alginate. Alginates are a polysaccharide, meaning a long chain of many sugars. But unlike typical sugars or starches, alginates aren't dissolved or digested in the same way that sugars or starches are in your body. Instead, alginates are more of a soluble fiber, and so they are actually helpful in terms of bulking up the food that you eat and also helping with digestive health and normalization of bowel movements. However, just like any other soluble fiber, if not taken with enough water, that can potentially lead to constipation. That being said, we don't really see that often in alginate-based products. Alginates have been used for decades in the management of acid reflux and acid-related symptoms. Alginates have also been used by chefs or cooks or molecular gastronomists trying to be very creative with either their food products or their beverages. And many people may have seen gel-based spheres which have bursts of flavor or coloring that have been used to accentuate the food or beverage that the creative person has been trying to incorporate into their presentation. How does alginate therapy work? Alginates have an interesting property of forming a hydrogel in the presence of water, acid, and other types of salts, such as calcium. The polysaccharide matrix within the alginates cross-link or bond together in the presence of water that forms this gel that actually remains somewhat insoluble for a couple of hours. The alginates, when taken, interact with the stomach acid and again some of the other ingredients that we have in RefluxRaft, which creates carbon dioxide, which then incorporates into that gel, helping that gel float to the surface of the stomach, creating a natural cap to the food and liquid that are in the stomach. This then creates this barrier that separates the stomach contents from the esophagus so that food and liquid within your stomach can't come up into the esophagus. As a result, if reflux doesn't occur, because the only thing that reflux is either this gel or nothing whatsoever because that cap has effectively formed a plug, then reflux-related symptoms go away because the acid and enzymes no longer have access to your esophagus or your throat. When should I not use alginate-based therapy? It's not a great reason really not to try alginate therapy in order to manage reflux-related symptoms. Studies have shown that it works even in the presence of other acid-blocking agents, although its effectiveness may be slightly reduced since there is a requirement for some acid to be present in the stomach in order for the hydrogel that alginates form to become incorporated. If people have allergies to seaweed or other alginate-based products, then an alginate-based reflux therapy should probably be avoided as well. When we speak about when to use alginates, we do recommend taking an alginate-based therapy for acid reflux either after the meal, up to about 30 minutes from the meal, which may be useful for its optimal effect, or at bedtime to protect the stomach and esophagus over the course of the evening.